Well, I had a significant discomfort in my hips. Well, I had a difficult time sleeping. I couldn't, when I was driving, I was constantly shifting positions to try and find a comfort spot. I couldn't walk very far. My work required me to do a lot of teaching and lecturing, and so I always had to ask for a stool because I couldn't stand very long at any periods. And it was just really, I just felt miserable. I couldn't do a lot of the things I liked to golf. I just couldn't do that. The amniotic allograft is completely different because it's not surgical. It's trying to rebuild the cartilage and strengthen the joint and all. So that's number one, which was a real comfort for me. I had spoken to an orthopedic surgeon about hip replacement, and I just couldn't. I didn't want anybody cutting my leg off. After the allograft, then starting the program with Dr. Dixon in terms of the rehabilitation, rebuilding the muscles, and getting flexibility back into the joints. It's just that it seemed like every time that I would meet with him, we were doing something a little bit different to target a specific function or a specific area. There's also discussion about my gait, trying to, because over the course of having the bad hips, my gait was altered. It wasn't normal, and so that affected my muscles. The program here really takes a look at all of those aspects of it's not just one thing. It's just like you can get the allograft and just walk out and you're dancing. It takes time to. I think the care and attention to those things is what really impressed me. Still impresses me. Have created kind of tangible benchmarks, things that really tell me that I'm improving, other than the doctors telling me I'm improving. Things like being able to put on my socks without having to grunt or make a run at it. I can just do that, and even tying my shoes. One of the tangible things that you can see is where the bow is, right? And so, like when my hips were really bad, the bow would be towards the inside of the shoe instead of in the middle. And so I'm always looking at how close to the middle I am now. And if you want it to work, you have to commit. It's not a one-way. It's not a one-way thing. Like, you guys are doing stuff to me, and it's just going to happen. There are things that I have to do a heck of a lot better. And I think probably the one word that I have is optimistic, because I believe that this is going to work, and it has. I don't think that I'm going to be someone who is going to just be sitting in a chair all the time. I know golf is back in my future somewhere. I'll be just as bad as I used to be, but it'll be there. I'm glad I did it.